my choice of a tough
Hello? Hello, Ashley, can you hear?
Yes.
Is it backdrop okay?
Yes. Wonderful.
Can you hear me? Just want to make sure.
Yes.
Okay, thanks.
Okay, it's 4 o'clock, so we will kick things off. We want to thank everybody for joining us. We have a wonderful program planned this afternoon on the Wednesday before Thanksgiving. We have a great panel of real medical experts that live right here in our community, and we're very pleased to be able to share their expertise this afternoon as our community continues to deal with the COVID-19 situation. Today we have Dr. Shireen Palmer with us. She is the medical director for Lewis County Public Health. We have Dr. Sean Harney, Chief Medical Officer for the Employed Physician Practices at Lewis County Health System. We have Dr. Nate Herr with us, who is a physician at Upstate Medical and a Lewis County native. And we have Ashley Waite, Director of Lewis County Public Health, and Jerry Kayer, CEO of the Lewis County Health System. So we have taken some questions that people have commented over the last couple days And we've got some of those already in the queue to shoot off to our experts here. But we also will be taking questions live. So I'll be monitoring Facebook if you're watching on the Lewis County Public Health feed, or if you're watching on linkinglewiscounty.com or any of the other feeds that may be carrying this. I'll do my best to juggle between the feeds and make sure that we're getting everybody's questions and pushing them out to our panel of wonderful experts. First, though, we're going to start with a brief presentation from Dr. Herr, just establishing the facts about COVID-19. And Dr. Herr's been working in the field from day one in Onondaga County. He has seen, what this virus really can do to his patients. And so he's going to share some of his experience and some facts with us before we get to the question and answer part. So Doc, go ahead and take it away.
All right, thanks. Thanks for having me here today. I'm just going to double check a couple technical things here. All right, so thanks for having me, and it's an honor to be invited today to open up today's town hall with you all. As Ryan mentioned, I am from Lowville, and I'm now a teaching physician at SUNY Upstate in the Department of Pediatrics. I also help to cover some of the pediatric care at Lewis County General on some weekends. And to do this today, I wanted to admit that 2020 has been a year of distractions. I'm glad we're taking time for this town hall. You can see the title of this opening presentation and the 10-minute mark that I have to hit, so we're going to go ahead and get started. So I'll be answering two of the more broad questions right up front. The first is, if most people are barely sick, how much should we be doing about this? And the second question is, if I'm hearing about the flu, how is COVID any different? And to answer these questions, I'm going to be pulling from an approach I've seen work at Upstate during the pandemic. And the first of this approach is that questions are good. I can tell you I've heard your exact questions asked countless times as the pandemic and the regional response has evolved. The second is that these questions arise as situations change, and we go back to the virus itself and build up from there to today. We can follow the trends to get some of our answers. So we can't have this talk today without talking about really understanding what the coronavirus is. And here's a picture of it. There are many common coronaviruses, and they do make a good chunk of the common colds that go around, and they will always do this. They're pretty mild, and our protection to them varies from year to year, depending on how many of these infections we've had recently. They went through the effort to subtype and name a few of them, but for the most part, they're not that exciting. And then there's a separate group of coronaviruses, and these are new strains that have jumped from animals. We've had three main strains in the last 20 years that have proven to be problematic. They leap from animals such as bats, camels, palm civets to the humans, and then because they are new, they're free to spread from person to person with nothing in our bodies to stand in their way. In 2002, we had SARS. In 2012, we had MERS. And in 2019, there's COVID-19. So I'm going to go through with everybody now the path and timeline of COVID so that we can help answer some of the questions that you've given to us. So to start, when you catch COVID, the virus has to touch your nose, throat, or eye. The virus docks and enters cells and nothing happens, or so you think. You feel nothing at this time, but the virus is hiding inside the lining of your throat and nose, reproducing. Your body's immune system hasn't even responded to it yet, and if you get tested, it will be negative. This is the incubation period after exposure. It's usually after 5 days, but it can be anywhere from 2 to 14 days when the virus reaches its limits of reproducing and breaks out of the cells and gets back into your secretions. COVID is stable also in our intestines, so if we swallow it, it goes there too. When COVID started, we knew that there was an end to the spectrum of the illness that would be extremely mild. And now we know that it's not only possible, but it's a fourth of all the COVID cases we see. You are contagious during this time, and you may even test positive. But if you feel something as the virus breaks out, the virus is now in high numbers, and 3/4 of the people do feel something from COVID. And many adults will admit that they feel like they've been hit by a truck. COVID goes almost anywhere and everywhere, traveling in the blood, the gut that I mentioned before, and it can dock on all major organs thanks to that yellow knob I showed you in that first picture. Because there's a receiver to that yellow knob on most every major organ and also the blood vessels in our body. Got so broad. You can feel just about anything with COVID because the virus is anywhere and almost in your body. And while we tried hard to find a more reliable symptom that would link us to COVID or tell us that it's not, nothing ever panned out, and no symptom is more or less reliable than the other. While I'm mentioning symptoms, I have to remind us all that there are symptoms we need to be on the alert for, and these would be things to call 911 and seek emergency care. This would be these symptoms, and feeling this way is a sign of serious involvement in the lungs by COVID pneumonia. So as you're sick with it, and once you feel the symptoms, you can then spread for up to 10 more days. As you spread it, a mix of droplets come out in different sizes. They go different distances, but most of them fall short within a few feet. If someone is nearby or touches one of these droplets and then their face, or they breathe in the droplet directly, the process starts all over again with them. So that's how the virus moves through a person into the next. And this is looking big picture versus through population. On the left, on the right, we have Lewis County. Anyone at any age can catch the virus and be infected by it. When I see it, I find it striking that most cases are in the working ages of 18 to 64. We are the people moving about and spreading most of the virus. And there are also many people who get this virus who need a hospital. As of today, Lewis County has had 307 cases. 27 or 9% have needed hospital care. 9 of these needed transfer to get critical ICU care. And sadly, we have had 4 COVID-related deaths. I want to take that chart I had before with the spread of who is getting coronavirus, and these are Lewis County numbers, and then also who is needing hospital care. And you see that there is overlap, but most of the cases fall right in the middle of who gets sick, right at the middle age of 50. And only a little bit above that, by 10 or 20 years, you have most people needing their hospital care. There are also more people getting COVID, and then therefore more people needing the hospital. And so we see the trend of this over time. You have the blue line, which represents the active cases on any given day in Lewis County, and then the green line, which shows the number of people of Lewis County residents who are currently in the hospital for this illness. And now if we move out of Lewis County to where I'm sitting now in Syracuse, we see the same trend. And the numbers there are numbers on this graph, but really all you have to see is that it's going up. The health system here we're stretched like never before. More units are being opened and converted to COVID units, and the staff pool of everybody, respiratory therapists, CNAs, nurses, lab technicians, and physicians is going deep and to care for patients with COVID, and also provide some of the many COVID treatments that are now available. The only way that we can turn this around is to have less new infections, and that's where I'm going to talk about next. And to do this, we need to be doing more, and we need to be doing it together. So if we look back at the life cycle of the virus that I opened with, we need to find ways that we can interrupt it. First, I think about the incubation period after exposure, when the virus is just duplicating and growing in you, and you won't feel anything. At this time, think about, please participate with contact tracing with public health and quarantine to get ahead of the virus and stop the spread. And Ashley Waite will talk more about this later in the town hall. Another way, when you think about the life cycle of the virus, is to wear a mask and wear it well. This will keep the droplets coming out of your mouth when you talk, and certainly when you cough, not only close to you and not out in the world for others to find and get into them and infect them. It worked well for the service members on the USS Theodore Roosevelt in the outbreak they had on their ship. The choice that some service members made to wear a mask protected them. And also studying what happened on that ship has guided our current mask policies. And these were young, healthy, active service members. And I think that's an important distinction to make, because that is who is carrying the COVID in this country and in our county. Remember that 75% of COVID is happening in those who are moving around ages 18 to 64. We need to keep our coworkers safe, and we also need to keep those who are in our home safe from our work exposure. And lastly, I want to address the question that many have had about coronavirus, COVID and the flu. And hopefully just what I've shared about COVID today is started to sound different from what you've heard about the flu. But that said, when I hear questions about the flu and COVID, what I hear is more along the lines of, well, I'm used to the flu. I'm comfortable thinking about it. I make decisions every year about the flu, whether I think I'm going to get it, whether I need the flu shot, whether I don't, and what I need to do with my family if any of us comes down with the flu. Where COVID is very different. The flu has never caused this much death. I was looking at COVID trends and flu trends, respiratory illnesses, and I found this graph from the CDC, and it honestly shocked me. I want to break it down and look at the red line, which is the percentage of deaths on any given week in the USA from respiratory infections. No matter if the death comes from pneumonia, COVID, flu, or an undefined pneumonia. It's the one big bucket of a cause of death. And this cause of death most of the time is bumping up and down between 6 and 10%. It goes up in the winter at the same time that flu is being diagnosed, and then falls back down, up and down, up and down. And then in the 10th week of 2020, which was March, deaths from respiratory infections skyrocket at the identical time that coronavirus diagnoses were being made. This sharp rise is what drove the fear that we had about respiratory deaths from COVID, the talk of ventilator supply, and more. And yes, we've controlled it better since then, but this COVID is still not like the flu, and it demands our constant and careful attention. And so in conclusion, that's my conclusion for this opening presentation. And we may pull back to some of the information that was given as the discussion continues. But I'd like now to turn it back to Ryan to take us to the next questions of the town hall.
Excellent. Thank you, Nate. Wonderful, wonderful information. Why don't you end your screen share so everybody can see our wonderful panel here. And then when we want to bring up a specific slide, you can just hit that screen share button again. Our first question comes from Julie. Julie asks, there appears to be a window of time where being tested is most reliable and effective. If you suspect you've been exposed, when is the best time to get tested? Ashley, can you talk about that one?
Yep. So the majority of people will turn positive if they're going to between day 5 and day 10 after exposure, with a peak at day 7. So we generally tell people to get tested between day 7 and day 10 of their quarantine period. And this is for 2 reasons. Number one, it's in the later part of their quarantine period, so they're getting either a negative or a positive result prior to being released. So we know to prevent further spread, as well as being within that time frame of the majority of people that will test positive if they're going to.
Wonderful. Thank you, Ashley. Our next question is from Dawn. Dawn asks, are there going to be any more rapid tests available in Lewis County? Well, Dr. Harney and the Lewis County Health System has been certainly our partners and the lead on testing. And we're doing more testing per capita than many comparable counties of our size. So Dr. Harney, why don't you help Dawn with her question about will there be any more rapid tests available in Lewis County?
I will do that. I think the first thing that I'd like to do is put one addendum on to Ashley's comment about testing. That would be for the asymptomatic patients. For people who are in quarantine who become symptomatic with any of the 9 or 10 listed symptoms on Dr. Herr's slide, I would recommend that they get tested within 1 to 2 days. So are there going to be more rapid tests available in Lewis County? Yes, there are currently a supply of rapid tests available of a few sorts in Lewis County. As far as their availability to the community is a little bit different. In the past, we have run some community testing clinics where we did large scale access to rapid testing. That is an incredibly time consuming and of our staff time to do those large rapid testing clinics. So we are currently deploying all of our rapid testing resources to more targeted groups where time is more critical, specifically treating the people who are in quarantine who become, or testing people who are in quarantine that become symptomatic. We're using rapid testing for that group of people. And we're using it for people who are being sick in the emergency department, being admitted to the hospital, some for pre-op testing and other more time critical resources. For routine asymptomatic testing, we're not using, in the immediate future, we are not going to use rapid tests for those people.
Very good. Thank you, Doctor. Our next question comes from Hayden. Hayden asks, has there been any outreach to the Amish community? And I can say for certain that there has. I myself have even been out to visit them. But Ashley, why don't you talk about our efforts with that community here in Lewis County?
Yes, the county has been working with the Amish community from the start of this pandemic, providing education in regard to the virus itself, how it is transmitted, the guidelines that are in place in regard to wearing a mask, washing your hands, social distancing, quarantining, what symptoms to look for, as well as where and how to get tested. So we've also provided supplies to this community, and they've been good partners throughout the pandemic.
Absolutely. This question was submitted anonymously. If mouth droplets can so easily be transmitted in the air, why do schools allow mask breaks? Does that defeat the purpose? Dr. Palmer, you've been working with the children in our community and has helped us with some of our school communication. So why don't you take that one?
Okay. I believe that the main benefit of doing that is parents initially expressed concern about having their kids wear masks all day. And the decision was made to allow them to kind of, in a way, stretch, where you take your mask off for a little while and then put it back on. I think that a lot of care is taken to make sure that they maintain the social distancing so that people are not coming close to each other during that period of time. And I think it is also a teachable moment for the kids. They have a chance to, make sure their mask is putting it back on properly. And so I think it was primarily an issue of trying to give kids a break and relieving some parents' concerns about having their kids have a mask on constantly for 6 hours while they're in school.
Very good. Thank you, Doctor. Our next question is also submitted anonymously. My workplace requires a face mask and a face shield. Is that overkill? What is the difference between the two? Dr. Harney, you want to take a stab at that?
Sure. I'd be happy to. No, Anonymous, I do not believe that it is overkill in many situations. Face shields do add to the effectiveness of face masks. They're not doing the same thing. What face shields do is significantly decrease the large droplet exposure to the front of a mask. There's some studies that show up to 95% decrease in the amount of contamination of the front of a mask with droplets when a face shield is worn over a mask. Must be noted, however, that a face shield alone does not afford adequate protection because there can be small droplets that get around behind the face mask and are inhaled into your nose or that would potentially infect you. So I would not recommend people use a face shield instead of a mask. But in many cases where people are going to be in close proximity to each other or spend a period of time in each other's company where one is potentially contaminated or infected, a face shield can increase the effectiveness of a face mask.
Wonderful. Thank you, Doctor. The next question says, can Dr. Palmer speak to the severity of symptoms in the kids that she is seeing? Is this different from symptoms with adults? Doc?
Well, I believe it is different than symptoms with adults because it's less severe. You know, children seem to handle the infection better. Talking to some of my colleagues, cases that they've seen, things like mild congestion, a little bit of cold symptoms, a little bit of malaise. In some cases, the kids are being tested because there's been a known exposure, and the children have very mild symptoms that normally wouldn't come to medical attention. So I think and fever has been something we've seen as well, although not high fever. So I think in general, this comes off as a regular cold. You know, there are some more severe sequelae that have been seen nationally. Fortunately for us, we haven't seen them in our area.
Dr. Herr, you work with a younger population as well, and you've seen some more symptomatic folks in your health system in Syracuse. Any comments on that?
Yeah, we're definitely busy evaluating kids for doing testing, and we have
Frozen on yours.
The symptoms are very vague. No one thing is going to stand out. We highlighted at a presentation to schools last week that we had a 14-year-old who was sent home from school for vomiting, had some nausea that day. The next day she felt better, but came in for testing. That 14-year-old had coronavirus. We also had another interesting one. A child who had at daycare and had a snotty nose for 2 or 3 weeks. It was a situation where they were otherwise well. We were sure, is this something that still fits? And that patient also had coronavirus. So really can't rely on any one symptom. The symptoms do tend to be mild, but there are the rare cases of inflammatory disease, and we've seen a handful of those cases at SUNY Upstate.
Very good. Our next question.
Ryan, one note too. So the case range we've seen as young as 5 months and up to age 18, just so people know. So infants can test positive and have tested positive.
Good point.
Thanks.
Okay, our next question is for Ashley. Why aren't positive cases required to be tested before returning to work?
So some cases will continue to test positive far after they're infectious. So the CDC has performed multiple studies where they've tried to culture the virus from the nose, and they've been unsuccessful in doing so 10 days after infection. So this shows that they're no longer contagious. The PCR test that we do is testing for the genetic material of the virus. It's very sensitive, very specific. This can be positive for, weeks after somebody is determined to be non-infectious and released from isolation and free to be what we like to say, you're free to continue social distancing. So you still need to take precautions just like everybody else, but they're free to go back to work without a test.
Wonderful. That's one that sounds a little scary until you hear it explained. Dorinda asks, I've heard people say that COVID is just the flu. Can you clarify? Now, we already talked a little bit about that with Dr. Herr, but would the other doctors like to comment on that? It's, you know, it's just the flu. How many times have we heard that?
Sure, Ryan. I guess I would say in response to that, no, COVID is not just the flu. We can see fairly well that COVID is fairly more infectious or more transmissible between people than the standard flu is, as we've seen from the news and other events locally where a single event results in numerous people coming away infected. The other thing that I think is fairly obviously a significant difference between the two, between COVID and influenza, is there's significantly more death and morbidity or sickness associated with COVID than there is with influenza. As you saw from Dr. Herr's slides, that sharp peak and the death rate in the early part of this year shows that compared to a standard flu season, already in 2020, we've seen a huge difference in the number of Americans die and New York State residents die from COVID than a standard influenza season, or even some of the more severe influenza seasons.
I want to add something too to that. I've heard from people a lot that, you know, I never get flu, you know, usually if I get it, it's very mild, so I'm not that concerned about coronavirus. The thing I just want to remind people is that the reason why it's called novel is because our immune systems have never seen it. So, you know, you may have a case of flu that you're benefiting from some prior infection back when you were younger and your immune system is primed to fight it off. Whereas with COVID-19, by definition, a novel coronavirus, your immune system has no memory. There might be some helper T cells that come along with it that may be benefiting some people with recent coronavirus infections. But in general, that seems to be, if it's real, it might be more for kids. But for adults, your body has never seen this before. And so you can't count on your prior behavior in response to viral infections.
Well said. This next question comes from Mary. Mary asks, some people don't think they need to be tested unless they have a loss of taste or smell. What are the other symptoms that should trigger a test? We hear that a lot, right? The loss of taste and smell. Dr. Harney, you've got can you weigh in on that for us?
Sure. Not everyone that's symptomatic with COVID will have anosmia or the loss of taste and smell. That's certainly the case. It seems like maybe young adults have a little bit higher incidence of noticing that symptom. People in the teen to 30 and 40-year-old age range. But there certainly are a group of other symptoms that should necessitate somebody seeking out a COVID test or suspecting that their infection is from COVID. And that would be the list that Dr. Her slide showed, which would be fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, sore throat, congestion, and nausea, vomiting, and diarrhea or gastrointestinal symptoms can also be the presenting symptoms of a COVID infection. Anybody else have comments in that direction? Okay, Ryan.
I put myself on mute. Kathleen has another question about testing. Why do we use nasal swabs instead of cheek swabs? I've heard that nasal swabs are painful. And that's kind of what we all hear, that, you know, see on the news, the big long swabs that go way up your nose. What's the deal with those? Why do we use them? Dr. Palmer, you've performed some tests. Why don't you take that one and describe kind of what's going on with the testing?
Sure. So some of the earlier tests that we used, the prescribed way for the test to be administered, the way it's studied, the way it's given to us, and how we have to collect it was what we call a nasopharyngeal swab, which means it's not just in the front of the nose, but rather goes back to the pharyngeal area. So it's a fairly deep swab and has a little bit of a burning sensation and discomfort associated with it. We still do need to use that swab occasionally for patients who are very sick or being hospitalized. There's certain times that still needs to be administered. However, the next generation of tests that came out are much kinder to administer, and they are a nasal swab where you actually just do the front of the nose, and it's a lot less irritating for patients young and old. Typically what will happen is if you're going to be tested, we'll do a nasal swab and we'll basically have you, I got my little mask here. We'll basically have your mask on, we'd have you pull it down so your mouth would still be covered, and they would just swab each nostril a few seconds on one side, a few seconds on the other. And, you know, it's effective, you know, all these tests have different operating characteristics, but in general, a very effective way to screen for positive cases. And I think it's been very well tolerated. So I wouldn't let that deter you from getting tested. I have little kids who do fine and smile at me, and well, not smile, but I can tell by their eyes they're smiling, you know, afterwards. So it's really nothing to be feared.
I would second that opinion, Dr. Palmer.
Mm-hmm.
And last week we did approximately 600 tests through our community testing drive-through. We did children that were in car seats, you know, 6 or 8 months old, I think was the youngest one, and all age children, adults, and people are tolerating the nasal swabs that we're doing quite well, much better than the previous nasopharyngeal swabs we used. So I would definitely agree with that, and encourage people not to be fearful of testing because of discomfort. It's a very easy test.
And I believe there are some places like college campuses that are using like the cheek swabs, but that's not something that is widely available commercially to us. And I will say pharyngeal swabs, I have, like, if you have a patient that has a contraindication to do any kind of swab in the nose, we can also do pharyngeal, but honestly, I think those are a little more irritating and patients tend to expectorate a little bit more. So we avoid them because it's a little bit higher risk to the operator of the test.
I'll also add here in Lewis County, none of the tests that we have available to us in the health system are approved to be used with cheek swabs.
So nothing to be scared, to be afraid of. If the children that if the children that Dr. Palmer sees can handle it, then certainly we all can handle it.
And a child will leave them, Ryan.
I used to get allergy shots when I was a kid. I know what it's like. All right. Ben asks, what is the county doing to ensure there's proper staffing levels at the nursing home? So we do have the CEO of our health system, Jerry Kayer, with us. Jerry, can you address this question about nursing home staffing?
Can't hear you.
You're on mute, Jerry.
Yeah, that's a very good question. As the elderly, as we all know, are at high risk. Particularly those elderly living in a congregate living environment. I also want to take the opportunity just to reflect on our staff. They are working very hard, and you know, the physicians, the APPs, the RNs, the LPNs, the CNAs, the ward clerks, environmental services, infection prevention, dietary maintenance, they're at it every single day. And it's a daily focus in our health system. We meet in a very organized way as a small management team. And then a couple of times a day, we're evaluating staffing on a shift-by-shift basis. Working in long-term care is not easy ever. But it has become particularly challenging during the pandemic. In long-term care, generally speaking, the Department of Health makes routine and unannounced visits. So sort of the watchdog agency here to make sure that we are doing the best we can, that we are following all the guidance, the directives, the regulations. And we have had, over the period of the pandemic, specific to the nursing home, 4 of those types of reviews. The last one was as recently as a week and a half ago. And it's a very thorough and intense review. They review staffing, they review infection prevention measures, they review PPE supplies, not just looking in a closet to see if we have a few boxes, but there are actual counts to evaluate our supply levels. Right now within our health system and the nursing home, we are, depending on the item, between 90 and 120 days of inventory. We have a team in our materials management department constantly working on the supply chain and making sure we have the equipment. So there is no time during the pandemic where we haven't been without the appropriate equipment. In addition to that, our staff development office has provided consistent education and re-education on the appropriate use of PPEs, how to put it on, how to take it off, how to be safe. Specific to the staffing, we have reassigned individuals from other areas of the organization to the nursing home. We are also using agency staff, which means individuals brought from outside of our organization to supplement staffing. We are also using overtime. We are also in long-term care, there's something known as mandation, which is individuals being asked to stay for an extra 4 hours or 8 hours. And the expectation is that they would until we can meet the appropriate levels of staffing on the next shift. That's something we try hard not to do and puts a lot of stress on our employees. We also use casuals, individuals who don't work a specific or defined shift, but work shifts as their schedules allow. So I think by my answer, you can tell that it's a multi-pronged approach. Now, one of the things we need to keep in mind, and there are studies over the last month that are verifying this, is as community spread goes up, nursing homes across the state and across the country are showing increased numbers. And our increase coincided with our increase at the residential healthcare facility coincided with the increase in community spread. And it's very challenging time, but the staff are really stepping up. They're working hard. And I believe there is an endpoint, but we'll have to continue to focus on a day-by-day basis and be creative with what we need to do to staff.
Great, thank you, Jerry. An important topic as we consider, we've been talking from day one about the most vulnerable folks in our community and how important it is that our actions, help protect them. And that's certainly what we're talking about when we talk about our families that are residing in the nursing home. Our next question is anonymously submitted. It says, first it was large gatherings. Now we can't even gather amongst our family. Why are small gatherings dangerous? Ashley, can you start us off? And then I know some of the other docs want to weigh in on this as well.
Yes. So we are seeing within our contact tracing that certainly small family gatherings are a source of spread, and even household contacts. 59 of our most recent cases have come from just household contacts. So when you're gathering, even just a few of you in the house, there is a chance for spread. So that is why it's important to maintain your cohort and not intermingle those cohorts. So Dr. Palmer, do you want to talk a little bit about how we can do that on Thanksgiving?
Yeah, something we've talked some about at the office too, and with patients. I think what we're sincerely hoping is that people are planning small gatherings, and like you said, within their own individual cohort. I know that plans are already made, and so looking toward tomorrow, I guess some suggestions that we would have for people to consider, kind of our appeal to you, would be if you're going to have Thanksgiving dinner with people outside of your cohort, doing a buffet style meal would be something that might be helpful, so that you can be physically distanced from other people while you're eating, because that of course is the highest, one of the highest risk activities. And another thing, then if you're going to gather on the table to visit or to do game night or something, at that point, we really ask you to consider wearing a mask. We know masks are helpful. Nate mentioned in his presentation, we've seen within our school districts that cases have presented to school, and yet there hasn't been transmission within the school. And that's because of the masks and the physical distancing. So we know they work. So we ask you to utilize those as a tool. I think other things to consider is having hand sanitizer around. So if someone has to reach up to adjust their mask, they're doing it with hands that are clean, either from hand washing or with hand sanitizer. The CDC recommends, now that's for the whole country, but if you can do some activities outdoors, sometimes people have covered spaces, maybe they could do, or an outdoor bonfire. Another thing would just be having your windows open, see if you could do cross ventilation to try to encourage air movement within your room. The other thing I've asked people to consider is kind of taking a leadership role within your family. Sometimes you get to a gathering and people tend to follow the crowd, and if there's one person who's kind of saying, hey, let's have grandma sit over here, and make sure that there's appropriate distance between her and other folks, that may be a way to at least offset some of the risk that people are going to be taking tomorrow. So I think what we do over the holidays makes a huge difference. And I guess on behalf of all of my primary care colleagues, I just beg you to make good decisions and try to take care of each other.
Well said, Dr. Palmer. What we're really talking about with cohort, we really mean a bubble, right? The people that are in your bubble, your immediate household, maybe some of your, some good friends that you've been, your kids have been playing together, but mixing with your aunt and uncle who live in Erie County, and your cousin and her husband that live down in, Albany. Those are the types of decisions that we're talking about, where staying in your bubble and that cohort is very important.
One last thing, sorry, I also said, if you're sick, don't go to dinner. Please, if you've got a stuffy nose, if you've got a cold, we mentioned with kids earlier, they don't have extreme symptoms. So if your child has a cold, don't share it, because you may be sharing COVID, and the implications may get much more severe down the road as it spreads to people who are medically vulnerable. So if you're sick, stay home, ask your family members to drop off a meal at the door.
There's one family I know in Lowville that's doing a takeout style Thanksgiving, where they're cooking a big meal, and then each of their kids and their families are driving through to come pick it up. So we got to get creative this year. The next question is, there's only been 4 deaths out of 27,000 people in Lewis County. That doesn't seem like a lot. What's the big deal anyway? I know that the doctors certainly have strong opinions about this, so I'll open it up to you guys.
Well, I guess I'd like to open on that. And it is a big deal currently to 4 families in this county that lost a loved one prematurely to COVID. What will be a really, really big deal is if you do the math and we as a county don't take action to limit the spread, and we have transmission through the population, we're going to be talking about 200 families potentially in this county having to deal with the loss prematurely of a loved one. And we really don't want to go there. I don't want to lose that many neighbors and friends.
Yeah, one thing I like, Dr. Harney and I and Ashley, really back from the beginning of the pandemic in March, we've been kind of watching the numbers. And Doc, why don't you run us through the kind of the percentages and how you get to that number of 200? Because I think that's a great metric and something for people to keep in mind.
Yeah, how the number gets up in the range of potentially 200 deaths in our county is currently we've had approximately 1% of our population test positive based on fairly wide asymptomatic testing. I don't think there's a large number of people out there that have had it that haven't shown up in that number. So if you take that 1% in a standard pandemic sort of situation with an influenza or coronavirus like illness, you would expect that approximately 50% of the population will become affected. If you take the 4 deaths we've had so far and multiply it by 50 to go from 1% of the population to 50% having had COVID, that's how you get up in the neighborhood of 200. Depending on how you do go through the demographics and the percentages of mortality rates, if this goes through our community unchecked, that is, no matter which way you calculate it, you will come up with a number in that neighborhood, which I don't want to lose that many of our dear Lewis County friends, neighbors, and family.
I agree.
Ryan, I'd like to weigh in on that one as well. 3 of those 4 deaths occurred in the health system, 2 in the hospital, 1 in the nursing home. All 3 of the individuals who passed away lived in the residential healthcare facility, and it has had a profound impact on the individuals who cared for these individuals, these members of our community who passed away, and has really impacted in members of our team, both in the hospital and at the nursing home. So all lives are valued, and 4 in total, but 3 in our local health system are 3 too many.
Absolutely. Dr. Herr, you're working in a county that's had a higher percentage of the population that's been dealing with this, a little more densely populated community in Syracuse and Onondaga County. What's been your experience? Why is this such a big deal?
I think we're feeling the stress. We're feeling the stress with the healthcare system, and the people that work there. We had 24 cases a day, then 50 cases a day for a few months, and we got used to that. And then at first we were shocked by 250 new cases a day in the county, but after a few days of that, the number sounds normal, and then it sounds a little less, and we kind of get desensitized to the numbers. But then what hits about a week later is the feeling of how hard everybody is working with this shift, and that's the one take I've taken. The positives I've seen is, as part of our county has moved into yellow, and then even smaller areas now into orange, I do sense a rallying. I do feel more compliance when I'm out and about, and participation by everybody. We have children in the school. We supported the testing operation that had to be done, and it turned out to be a success. That's just one small example of some things that have been positive, and then we've been able to learn from that experience too with our schools.
Great, thanks, Doc. It's great to have you on. That's from a community that has we can see into the future, and we know what our future is if we don't kind of change some of the behavior. And we could certainly head the direction of Onondaga County, or the direction of some of the areas downstate that have had a really tough time, especially last spring. One more question is, why do we get this one a lot? I hear it on the streets. Why does public health continue to announce cases from the religious gathering in Croghan? That event was 5 weeks ago. There's been other public places that have had positives. Why is it always the church that gets singled out? And we do have a good reason for that, I promise. Ashley, can you take that one?
Yep. So this was really our only super spreader event. And the reason why you're seeing cases continue to be associated with that is because those cases that are coming in are ultimately linked back to that religious gathering. So until we stop seeing cases being linked to that, you will see cases being added to that. And again, this was the only real large super spreader event that we've had.
Dr. Harney, anything to add on that?
I guess I would hope that after seeing how that has adversely affected our county's health, that people would be very cautious about those sorts of activities in the future. And I like to go to gather and worship like many others in this county. However, large gatherings, especially where people may worship without masks or where there's a lot of physical contact, is potentially dangerous to our community. It's potentially dangerous to the elderly in our community. And we really have to be careful for a time being. And once this is over, I think we should have a large worship event. But until then, I think we need to be careful. And it's not just the church. It just, by happenstance, it was a group at a church. It could have been others. If you look other places, it's large graduation parties. It's lots of different events. Unfortunately, here it was and is still called the religious gathering. However, I think we just need to not look at it with any sense of blame, look at it as a historical fact and a reminder not to repeat that history in the future. So if you're going to gather for worship, if you're going to gather for whatever reason, do it carefully, do it with masks on, avoid physical touching unnecessarily amongst a large group of people. We just need to not repeat that history.
Yep. Very good. Very good. And I will say that Pastor Farney of the Apostolic Church has been wonderful partners, and that whole community has been really great to work with. So,
Ryan, can I add something with that too? I
Sure.
think that in some ways, someone across the bottom, there was a question that came over has there been community spread? I think it is of interest to us as providers when we see as the case numbers go up, how many of those are traceable cases to already known contact or already known positives. So from my perspective, in some ways, as our numbers climb, I want to know how many of those are community spread, meaning no known contact that was positive, and how many of them are already, traced and in the system. So we're fortunate. Ashley, I don't know if you want to comment on that, but we're fortunate that we don't have a lot of community spread. And I don't know if you want to share a little more on that.
Yep. So of our 234 most recent cases, really since October 19th, we've seen a spike in our cases. Only 19 of those have been untraceable, meaning we don't know where their exposure was. The remaining are known exposures, and we know where they picked up the virus. And that is good information for public health to have, because then we can affect the messaging that we're putting out. We can take action based on that, reach out to appropriate partners within our community to change behaviors so that we don't see further spread.
So
Very
we have a real opportunity to bend the curve in Lewis County,
Mm-hmm. Absolutely.
Mm-hmm.
Yeah, great point. So we're coming up on an hour here, and I think that's about perfect timing to wrap things up. Why don't we go around the horn? We'll give each of our medical experts here an opportunity for some parting words. my parting words would be, let's hope that we're not back here 2 weeks from now, and our providers are, getting off of back to back 24, 12-hour shifts because our health system capacity is being pushed to the brink. So let's go to Ashley first. Anything to wrap us up?
Just make good decisions tomorrow. We all need to do our part to slow the spread here in Lewis County.
Very good. Dr. Harney?
Yeah, I guess I would go back to a quote that I invented the last time we gathered. We need not be fearful. However, we do need to be careful.
Very good. Very good. Mr. Kerr?
Yeah, it's same old message. Wear a mask, social distance, and wash your hands frequently. And I'm also able to announce that today I received a notification. Our enrollment, the health system's enrollment in the New York State COVID-19 vaccination program has been approved. So there's been a lot in the media recently about the vaccination program, and we're positioned to start receiving vaccines. They haven't given a date, but once we get the information, we'll be sure to share it.
Very good. Dr. Palmer?
So I guess what I would say is when we moved here in 2001, one of the things that just impressed me was how people in this county are very resilient and how we sincerely care for each other. And I have continued to experience that as I've raised my 5 children here. And I've been so proud to be in this county since March. I'm so proud of the hospital I'm affiliated with, the lab I'm affiliated with, and the people that I work with. And I just want you to take care of each other, and I'll try to do the same. And happy Thanksgiving.
Very nice. Dr. Herr?
My part, this is hard work, and it goes layers out. I've been thinking about how, it's hard work to slow the virus, but then the things that we have to do then stress and are more work for our own lives. And so any way we can help each other, help your neighbor who's on quarantine, help your neighbor who's in isolation, so that it can help them, and reach out to get through these tough times, because doing those things is what's going to stop the virus, but it also takes work and support to take those actions and to be on quarantine and to be in isolation and to not forget about that part.
Very good. Thank you, Doctor. I want to thank all of our panelists for taking the time to be with us today. This video will remain on our county YouTube page for at least the near future, so it'll be available for anyone to take a look at. I want to thank everybody. I want to wish everyone that's watching and our panelists a very happy Thanksgiving. Be safe, wear a mask, wash your hands, and practice social distancing. With that, we will